So we begin our dynamic assessment looking at mobility, strength, and endurance, and we start with flexibility. And to get into this, we start to recall some of our stuff from 230 exercise science, and we talked about basic human movement, and we looked at this relationship between the musculature of the agonist versus the antagonist, as one muscle's contracting and other one's relaxing. So there's some review there. As we progress through KIN 230 into the biomechanics a little bit, we start talking about kinetic chains and how one joint movement can affect or influence movement in another joint. We looked at muscular physiology, looking at the sarcomere as the contractile unit of the muscle, and that sarcomeres run the entire length of the muscle that make up the myofibril. And then we also introduced this concept of active and passive insufficiency, looking at where muscles are strongest, such as in the mid-range position, and where they're weakest at the lengthened or shortened position. So active insufficiency for the shortened position and passive insufficiency. So if any of these terms here don't make any sense, I would pause this video and review those terms, the agonist, antagonist, kinetic chain, and we'll come up, but I think it's important that you review your 230 material before you do that. So when we look at flexibility, flexibility is the equivalent of mobility. And when we look at what this definition is, the ability to move through a full range of motion at a joint or at a series of joints. That's where the kinetic chain thing's coming in. So when we look at this mobility versus flexibility, there's a term that's going to come up later called extensibility, which sometimes gets confounded with these two other terms. And that's a little different aspect that's looking at tissue. But overall, the flexibility is the available range of motion. Do you have the resources to go through a full range of motion? And we get this slide again, this human movement system, this hierarchy of tissue control. And the way we look at this is that movement here, this is where the range of motion is going to occur, is down here. And this is a product of the articular system, so the joints, the shape of the joints, the ligaments, connective tissue. This is 100% controlled by the muscular system. The muscular system generates tension, and that tension is 100% controlled by the nervous system. So you have articular influences for range of motion, such as the joint shape, the structure, so forth. You have the muscular influences, so the actual extensibility, right? Does the muscle have the ability to lengthen? And then it also has input from the nervous system in terms of, is it giving a go signal or a stop signal? Then there's also some aspect of, are you actually putting tension on the nervous system from the structural components? One of the things that we introduce in this chain here is this hardware versus software component. And when we look at movement, it's a product of both. So hardware is the tissue, like the actual joint, muscle, and nerves. And then the software would be the signaling. So these arrows here represent the communication chain. So the communication from the nervous system to the muscular, communication through here, and then the feedback mechanisms that are coming back. And these feedback mechanisms are actually quite important. So when we look at movement, it's not just as simple as, does the muscle have enough stretch? Is it stretchy enough? Is it lengthy enough? Right? Is it all of these things working together that can produce quality movement? So we have agonist and antagonist relationship, and the reason why we're talking about this is not because one muscle's contracting, one's relaxing. It's to appreciate that when one thing's happening on one side of the axis, the opposite is happening on the other side. So when you have, in this case, the tricep, the elbow extensors are contracting, you are getting relaxation or lack of contraction on the flexor end, and vice versa. And this relationship can switch back and forth, agonist to antagonist, and then agonist, antagonist, and whoever's contracting is the agonist. And in order for movement to occur, the other side has to relax. And this is hardwired through the nervous system. And then we have this demonstration here where it shows you kind of the contraction to the right. And then as the right side is shortening, the left side is lengthening. So the muscle that's contracting going is shortening, and the muscle that's relaxing is lengthening. And then they switch roles, so you have the agonist on the left, antagonist on the right. Again, shortening on the left, lengthening on the right. And when you get back to neutral, you have this static position. And so this is depicted in the wrist flexion here, back and forth. And again, it's just a trade-off from left to right, looking at the flexion and extension. So we have this, you can see just in action, you can see the movement that's occurring from elbow flexion, from the bicep contracting, and then elbow extension from the triceps contracting. And then it's just a handoff back and forth. So you have your flexors acting as the agonist, and then you're going to have your extensors working as the agonist. And the signaling here, when you look at the hierarchy of tissue control, the signal going to the one muscle is getting the opposite signal to the antagonist muscle. So you're going back and forth from flexion to extension. And when we look at this agonist-antagonist relationship, you saw that there was no one side. The flexors weren't more important than the extensors, or the extensors were more important than the flexors, but there needs to be balance that happens between the agonist and antagonist. And you look at joint balance or symmetry, and what this looks like in the tissue is that you, at any given moment, the muscle tone or tension on one side should be equivalent or similar to the one on the opposite side. You can get this situation where you have an imbalance where the agonist is dominant and the antagonist is not. And that tends to be in this vernacular of shortened muscles or lengthened muscles. And as you would see on the left, as the agonist is contracting and shortening, and as the antagonist on the right is lengthening, if this is a chronic thing ongoing, you would say that the chronically shortened position has too much tone or too much tension, and we refer to that as tightness. And then on the opposite side of the axis, you would have a muscle that's too weak to counteract that force. And the takeaway from this is that you can't have one without the other, right? You can't have an agonist and not have an antagonist, and vice versa. Because if that situation, you would be just fully relaxed. And in this case, there's no agonist or no antagonist. So the fact that we have an agonist, that means we have an antagonist, and these roles will switch back and forth. When you're too tight on one side, you are also weak on the opposite side, and vice versa. If you're too short on one side, that means you're going to be too lengthened on the other. As this side is shortening, this is lengthening. It's a balance back and forth. You wouldn't be able to have two shortened muscles, or you would kind of just be in this really tight situation. So just keep in mind that what's happening on one side of the axis is you're getting the opposite, or at least another effect on the right side of the axis.